Good afternoon to all participants. On behalf of IAP technical team, I welcome to all participants and to our today's resource person, Dr. Ishita Parekh ma'am. Welcome you ma'am. Before hand over this webinar to our today's moderator, Dr. Prerna Sarvanan ma'am, I request to all participants please subscribe our own IAP YouTube channel for watching more and more live webinar. Thank you. Our today's moderator, Dr. Prerna Sarvanan ma'am. She is a state coordinator. Thank you, ma'am. Hand over to you, ma'am.
Thank you. Thank you so much, Alopi. Good afternoon, everybody. I would like to welcome all the participants on this platform on behalf of IAP Women's Cell and the Sarojini College of Physiotherapy, Surat. This webinar is organized by IAP Women's Cell, Surat District, Gujarat State, in association with the Sarojini College of Physiotherapy, Surat. Myself, Dr. Prerna Saravanan, working as a lecturer at the Sarojini College of Physiotherapy and a joint coordinator of IAP Women's Cell, Gujarat State. I would extend my gratitude towards Dr. Ruchi Vashney, the National Head of IAP Women's Cell, Dr. Pooja Kamble, the Zonal Head, IAP Women's Cell, Dr. Bhavna Gadbe Madam, the State Coordinator, Gujarat State, for providing such a wonderful opportunity to organize a webinar on this esteemed platform. Now, today's webinar is about Dr. Ishita Parekh's journey through multiples in Sclera and Oasis. This webinar is actually a different one than the other routine webinars, as the resource person is going to talk about her experiences as well as how she managed and how she is still managing herself with the multiple sclerosis. It's a webinar about Ishita's journey facing the real life challenges. Now let me introduce Dr. Ishita Parekh. It's my privilege to introduce Dr. Ishita Parekh. She completed her Bachelor of Physiotherapy studies from the Sarojini College of Physiotherapy, Surat, in the tenure of 2004 to 2009. She completed her Masters of Science in Physiotherapy from University of Western Cape, Cape Town, Republic of South Africa. Her research topic was factors influencing functional outcomes of stroke patients admitted in tertiary hospital during 2010 to 2012. She worked as a clinical therapist at a private physiotherapy center at Valsad, Gujarat. She also worked as a research assistant with Dr. Gillian at Developmental Coordination Disorder among the primary school learners in Cape Town Metro Central Educational District. She continued working as a problem-based learning facilitator, a practical demonstrator, and marker for students at the Department of Biology, University of Cape Town. She is working as a researcher at the Sclera Medicals, Valsad, Gujarat. She has published her articles or papers in various international journals. Before starting today's webinar, I would like to request all the participants to put up your questions in the chat box. Now I would request Dr. Ishita to please carry on with the session.
Thank you so much, ma'am. Am I heard now?
Yeah, yes, ma'am.
Yes, you're audible now.
Yeah. Okay, I'd like to thanks a lot to Dr. Prerna Sarvanan, who is actually my ma'am during my basic study of physiotherapy, and also to IAP Women's Cell, who had offered me to present a webinar regarding my condition. Actually, I wouldn't say a condition, it's basically an opportunity for me, being a physiotherapist. So I will start with my journey. Okay, I'm happy to present a webinar on my journey through multiple sclerosis. Okay, so since beginning of my childhood, since I was a small kid, I was quite busy and quite fond of doing graceful movements of dance. Specifically, it was Bharatanatyam and even folk dancing like Garba. So I was just all the time dancing and uh, like preparing for myself to do various activities. So it was a field of movement. And fortunately, for academic studies, I also got an admission to the field of movements, physiotherapy. In 2004, I got an admission in the Sarojini College of Physiotherapy, Surat. It is a bachelor's in physiotherapy course and it is for 4.5 years. So initial 2 years, I was just enjoying this study and enjoying new subjects like anatomy, physiology, and even exercise therapy and electrotherapy. I was enjoying to learning new things. But when I entered third year, it was also quite going quite well with pathophysiology. One day, when we had finished our final class, which had ended at 5 p.m., I suddenly had a sudden tingling numbness in my whole left upper extremity, starting from my back of my left limb to left shoulder to my fingers. It was so severe that I thought it could be due to stress. It could be due to just a strenuous day. So I was just releasing my hand, but it would not relieve at all. So two of my friends came back, not seeing me to come to like leave the college, but they also tried and it did not relieve at all. So they both took me to the hospital downstairs, and in hospital we entered around 5:15, and I had so many like anxiety and even the tingling would not go away. So all the initial vital parameters were checked and they were all normal except for my heart rate, which was beating so fast because I was in a state of like so much of surprisingness. What is happening to me? And slowly at 5:30, 5:35, 5:40, and around 5:45, it was all relieved. So slowly the symptom was gone. And as even doctor could not come on a conclusion what to do with this, he advised me to leave the hospital and just take some rest. That is what I did. But this was the first symptom happened and which lasted for around 45 minutes. But maybe this was the starting. That was my third year, and first symptom was just went away. And later on, over the period of time, over after a few months, I had various unusual symptoms like, say, weakness of foot, or blurring of vision, or frequency of urination, and yes, brain fog. Because I was taking so much stress for exams and studies and new subjects, although I was liking everything. And then we entered final year. But this series would not go away. I thought it's all fine. But again, I had foot drop and yes, hermit sign, in which there is an electrical shock like sensation in my hands when I look down, when I flex my neck, and even I had so much of spasm in both the upper trapezius. But everybody in my classroom, they all had this, and we were all discussing. We thought it could be all due to, like, now the study is like increasing, and it could be just due to wrong posture or just flexing your neck and reading that. But it would not relieve at all. I was just doing home remedies like hot water fermentation and using a soft pillow. So throughout this time, I was internally all the time very anxious. And being a physiotherapy student, I consulted many of our professors, lecturers, and even orthopedicians in our hospital, even the MD, but it was misdiagnosed as either thoracic outlet syndrome, that means a 13th rib, which can be just removed with surgery. And another was it could be cervical spinal stenosis or nerve compression, which was causing these problems. Because that time, the symptom lasting for a longer time was only hermit sign in my hands. So that lasted up till my end of my final year. But when I went home for a short vacation, it was actually diagnosed. It could be due to MS or tuberculoma, but it was obvious that it was relapsing remitting MS. And till then, no symptom was lasting for more than a week. Every symptom was just vanishing within a week's time. So I was just maybe I disregarded that all the symptoms and did not connected them. Okay, so what is multiple sclerosis? It is if you just look at the film, there is some white spots in my brain cavities. And what are these white spots? Our neurons, our nerve cells, are surrounded by an insulating fatty myelin sheath, which provides the impulses to go through the nerve cells smoothly. But in MS, there is a breakage of myelin sheath, and that is causing that white spots, whom I call as pearls. And the cause is unknown why this is happening. And it is believed that it is an autoimmune disease. Now, the treatment part comes after the diagnosis. As we had freshly studied about MS, allopathy and the modern science has injectable steroids, and also there is disease modifying treatment. And other side, it's Ayurveda, which has natural herbs and strict diet that you have to follow. As we had studied just a year back about MS, the consequences were in my mind that yes, we had studied this, but is it true? That was my question. So since beginning, I was very much questionable what is happening to me? No, it should not happen. No. So I was developing a positive attitude within me. And yes, I started uh, regular workouts as I had already finished my studies. So I could spare time for my workouts. And yes, another thing which I had to stick was to take regular medications and to follow strict diet. But along with this, my research about MS and even the treatment was going on continuously. As it was relapsing remitting. So initial 4 years were symptom free. I was just moving freely. So after I completed my internship and my degree, I went to Cape Town, South Africa for my master's study. My study was on stroke patients who were admitted to a tertiary hospital. And tertiary hospital where I was doing research, it is very famous for the first heart transplant surgery by Dr. Chris Bernard. And so it is one of the best hospitals among the world and even among the South Africa. So it is all the time very busy hospital. And in this hospital, as I was doing research, since morning till late afternoon and even sometimes till evening, I was busy with patients and doing research with them. And those were the days very busy all the day, I mean, all the time, that I was, yes, doing solo travels and even to India. And it was quite an active lifestyle. But in the year 2013, I had another relapse of weakness of my legs. I went for a long walk with a friend, and slowly, gradually, I had developed a weakness in my legs that has that had caused me to walk with difficulty. I thought it would go away in some time, as other symptom did, but it did not. Then I went home, and months have passed. And as I had decided, I had a plan to go for further studies of PhD after MSc. I did not. I wanted to relieve my symptom of weakness first before starting my further studies. So in September in 2013, I returned to India, and it was like symptoms were like waiting for me to attack me. I had initial symptoms of basic ADLs, like I had 9 to 10 hours sleep, even was, if you can see in the uh, image, going to the sideline and getting up from bed was literally very difficult. And I was just shocked. What is happening to me? I could not get up without support. Same with the brushing and holding a mug, and even fine moments, I had to hold a pen with the support of other hand. Even my hands were dancing while typing, and even holding a food and the movement of hand to mouth was difficult. But okay, let me tell you, what was the difficulty? The difficulty was shaking. It was tremors in my hand, and yes, tremors in my trunk as well while getting up. That was with fine moments, but symptoms were not ended. When I started walking, I had problems with balance and even so much of fatigue throughout the day and postural tremors. And yes, I had problems with my walking. What was the difficulty? I was walking uh, with wide base, and even I was lacking the heel strike phase. And symptoms did not end here. They just wanted to check me. And I noticed after some days that I have problems with thinking or memorizing something or recalling some names, and of course focusing on something, and of course, and yes, to uh, like my attention span was reduced. I could not attend one thing for a longer duration, not even a movie or a serial. But this did not end here, as it was the month of September and October. They are very much hot. So I again had noticed that I had some problem with heat and I could not tolerate heat. That means I was heat intolerant. That was a trigger that I have to stay in a cooler place. And again, the other triggers were waiting for me. The social media. I stopped using social media for around 1.5 years because I was then so much of chaotic in my mind. And yes, society. Seeing society was a trigger is not a proper thing, but actually, my approach towards society was not proper because I had to return to India again, and dealing with everybody was a little bit difficult for me. And yes, as MS is a very mysterious condition that even the person doesn't know what is happening. So I how could I explain to other people, not even to my family members? So explaining others caused so much of mental stress within myself initially. And yes, finance was another trigger. But in the dark clouds, there was a silver lining. My mother just once said that you are not finding anything, no therapy, no treatment, nothing. Then just try to read Bhagavad Gita. At that time, with huge anger, I opened Bhagavad Gita. Okay, mom, I'm going to read it. Okay, fine. But then, actually, that anger took me to calmness. And yes, at that time, I also had a slurred speech. So I started learning Vishnu Sahasranam. That is a very tongue twister Sanskrit verses. That and it took me around 8 to 10 months to learn. So my mother and grandmother, they both were teaching me every day how to speak. But then slowly, without knowing that I am speaking just fluently again. And yes, besides that, I mean, it had given me so much of inner energy that cannot be actually described. There was a time where I was so much of like surrounded by so many problems. And yes, along with this chanting, this Sanskrit, I had started just naturally meditation. It is not a guide, it was not, and it is not still a guided meditation by anybody. It is just within myself. So now comes to physio. Being a physiotherapist, I needed to be very much like active physically, and actually physical therapist has to be a fit person, but I was not fit. So I again started uh, physio, and how it helped me. So I started with muscle strengthening, stretching, and core posture and gait training, and yes, self counseling. And this all this training initially were done by me. I had started just as I was knowing that yes, these muscles had to be stretched and strengthened. So I had started the exercises for some time. I went to a physiotherapist, but again, I did it all alone by myself. And okay, these are the things. Initially, I had started with sorry, started with fine movements. There was no fixed time during the day. All the time, my hands were like this, like that, just trying to perform the strengthening exercises. And yes, I was always keeping the smiley ball beside me. Now comes core strengthening. I had bought this ball since 2013 end, and since then I'm doing the exercises. Initially, I was thinking that this ball is made just to fall me down because that time in 2013, I was falling down all the time. I could not perform this at all. But then slowly, I again started that no, you can do it. That was my self counseling. Yes. And now comes bridging. Initially, bridging did not last more than 2 seconds. I could not perform at all. And if you are seeing in the image that my both the legs are apart, it wasn't possible at all for around 3 to 3.5 years. I could not do it at all. But then again, with practice, consistent practice, I was doing unilateral bridging as all at all. I mean, that is also was done for around half a minute to sometimes 45 seconds. And another core exercises is prone planks for my erector spinae and even all the internal back muscles. And yes, this is another impossible exercise for me, that kneel standing was not possible at all for me. I could not stand even with support initially. But then I could do with support, but without support, it was not possible. My my uh, lower trunk was just dancing. It was just shaking. Then I started doing some balancing and even the extension in prone, say Bhujangasana. Then it was possible. And yes, then comes balance exercises. As I had taken my leg away, this wasn't possible before. And yes, this is Ustrasana and even Bhujangasana in prone. So I had started doing all this prone and extension exercises to strengthen my back muscles. But yes, this is all regarding my physical exercises. But I was feeling some incompleteness within me, that my mind wasn't actually calm. Then I thought, no, what is the thing that I should go for? I went for some yoga classes and to some spiritual leaders, but no, it did not solve my queries, my question. Then I found that in Pune, Sri B.K.S. Iyengar had developed yoga therapy that even patients and people of all ages can perform this. B.K.S. Iyengar had actually discovered the props with help of what? That people can do very so these are the silver lining towards those dark clouds. And yes, I was doing, I had already started physio with core and gait training and even stretching, strengthening, and different exercises. And yes, Shri P.K.S. Iyengar, who had developed various props to use for different difficult asanas as well. So these are some of the props with the help of which anybody can perform various like even difficult asanas very easily. And yes, the yogasana should be performed with calm mind and even for a longer duration to get maximum benefits, and even with alignment. And props provide that alignment and even support. So in 2017, I had decided to move to Pune to learn Iyengar Yoga. And initially, I was accompanied by a family member, and we stayed there for 2 months. And very slowly, I had started feeling some changes within myself. And we returned to Gujarat, to our hometown. And yes, as I had bought some props, I continued my yoga practice at home. And I could say it was a miracle that two or three major symptoms were vanishing. And I would name the symptoms like tingling numbness and in my hands and even sometimes legs. They were gone. Even some tremors in my hand were just gone away. And one another major symptom was kind of incontinence or frequency of urination. It was just gone. So I had decided and convinced my family that I would go back to Pune and will take yoga therapy course. Not really a course, but it's a therapy for a longer duration and will stay there. And by that time, I had developed that confidence within myself that I could stay there alone. And even with family support and even encouragement, I again went to Pune. But this time, I went there and stayed alone. And I was managing alone. And yes, again, I was traveling alone. I felt that yes, I can actually travel by myself, not looking for any company. I was just going alone. Okay, these are some of the changes happened in initial 6 months of starting Iyengar's yoga. Now looking at the physical things, that if you see this yogasana, it's Dvipad Viparit Dandasana, where whole my front body is stretched. Initially, it was very difficult for me that my legs would not just stretch like this because my iliopsoas and even quadriceps, they were kind of short. So with the help of physio, I was working on these muscle stretchings. So at the end, this was possible. Then comes one of the most difficult asana for me for around 1.5 years. I was sometimes frightened that, oh, this asana, it is like Adho Mukha Svanasana. It's forward faced dog pose that I have to do. But I could not skip that. If you can see in 2017 and 18, the pic on your left, my legs were tied and some therapist is standing beside me, and even I was using so many props to perform one asana. And yes, even after this uh, many props, I could just perform it for, I could maintain it for 1 or 2 minutes initially. And then with a lot of practice, consistent practice and encouragement, I could finally, in 2019, I could perform this asana with just minimal use of props. And even Sarvangasana, one of the best asana, which has just uh, moved me to Pune again. It is actually inversion asana, very good for my thyroid gland and even for my brain cells, that it provides like more blood supply to the brain and so many other benefits. That if you see 2017 pic, my leg was supported with bolster, but then in 2018, bolster was removed and it was just tried because I could not keep my legs just straight. This wasn't a difficult asana for me because I was fully supported by all these props. I was just able to perform this asana for around 10 minutes. And then it comes 2019 that I started without those props and I could perform the asana for at least for 10 minutes. Now comes halasana. Yes, you can just easily see the difference from 2017, so many props, and 2019. But all this happened with consistent practice. And yes, in 2019, after developing those physical strengths, I was simultaneously developing inner strength as well. It was losing the fear. So I had started again hydrotherapy. The fear of going till the pool alone and start with the treatment, with the therapy. So it was a difficult task initially for me to go to the pool and do it by myself. But then I had that confidence and strength that no, I can do it. Yes. And I had started solo travels from Pune to Gujarat by myself, alone. And yes, with overnight journey, I was uh, doing the traveling. So in 2019, another fearlessness that I saw is I just climbed down and up the stair without a bar beside it without a railing. Yes, another thing was I started socializing with even in Pune and yes, in my hometown, everything. And yes, another was even I was starting to do the things which were almost left. It was dancing. I still cannot dance well, but I can at least try dancing. So it's as you see, it's like so many things had come. Apart from those difficulties of symptoms, I had so many pillars like yoga, physio, Ayurveda, and even diet and calmness. And yes, I was even doing writing and connecting with people across the globe and socializing myself. So it is a matter of holistic healing. And Dr. Nadkarni, who is a young physio and yoga therapist, in whose clinic and yoga center I was taking yoga therapy and even physiotherapy. So she took me to like outside and made me realize that who am I? That I am not a waste box. I'm not a waste person. She made me realize that there is a reason for you being here on the earth. So she took me to even movies and plays and of course the restaurants and many shows, and she introduced me to many of the prominent people, and I am so much grateful for her. Thank you so much. And yes, these are the angels who came in my life, like across the globe. During my research, I found Dr. Miguel Castillo, Garth McLean from both from USA, and Mala Naidu from SA. All three were having MS. Were, that means they are all recovered, and I am so much like inspired by them. All three are in contact and still guiding me. And another thing is, I thank to each and every people who had come to my journey, and to not just to help me, but just to cross the way of my life. I thank you. Thanks a lot to all of them. Thank you so much. Thank you. Ma'am, it's done.
Are you able to hear me?
Yes.
Okay, it was a really wonderful session, and thank you so much, Ishita, for this amazing session. It was an enthusiasm exhibition from your courage, commitment, and high self-esteem. Your journey definitely encourages other patients to take the situation as a challenge and overcome it bravely and positively, the way you did and still you're doing. It was a great pleasure sharing the same platform with you, and very happy and proud being your teacher, and your inspiration and dedication to support many patients in the same situation. I would like to thank the entire team of IAP and IAP Women's Cell. I extend my special thanks to Sarojini Medical Trust running the Sarojini College of Physiotherapy, Surat. And I'd also like to thank the technical team for their non-stop support for the smooth functioning of this event. I heartily thank all the participants for their support for making the successful webinar. Thank you all. Stay safe. Happy weekend. Goodbye.
Thank you so much. Thank you so much, ma'am, for your kind appreciation and your support. Thank you.